How do high-risk HPV types increase cancer risk? Imagine a tiny virus that can quietly change the course of your health over many years. That's what high-risk human papillomavirus types do. They are linked to the development of certain cancers, especially in the reproductive system. The most common high-risk types are HPV-16 and HPV-18. These viruses infect skin and mucous membranes, often without causing symptoms, which makes them easy to spread through skin-to-skin contact during sexual activity. Once HPV infects a cell, it can produce proteins called E6 and E7. These proteins are the main culprits in increasing cancer risk. E6 targets a protein called P53, which normally acts as the cell's quality control officer. P53 helps repair damaged DNA or triggers cell death if the damage is too severe. When E6 degrades P53, the cell loses its ability to fix DNA errors or self-destruct when needed. This allows cells with genetic damage to survive and multiply. E7, on the other hand, inactivates a protein called retinoblastoma or PRB. PRB controls cell division, making sure cells only divide when necessary. When E7 disables PRB, cells begin to divide uncontrollably. This unchecked growth leads to the formation of abnormal cell clusters, which can evolve into precancerous lesions and eventually invasive cancer if left unchecked. The process usually starts with a persistent infection. Most HPV infections clear naturally as the immune system fights off the virus. But when the infection persists, the viral DNA can integrate into the host cell's genome. This integration causes continuous production of E6 and E7 proteins, which over time cause genetic and epigenetic changes. These changes include abnormal DNA methylation and histone modifications, further disabling tumor suppressor genes and promoting malignant transformation. This progression from infection to cancer can take many years or even decades. Factors like smoking, weakened immune systems from HIV or immunosuppressive treatments, and other infections can make it easier for HPV to cause trouble. These factors weaken the immune system's ability to clear the virus, increasing the chance that persistent infection will lead to cancer. In the case of cervical cancer, high-risk HPV types are a well-established cause. It is one of the most common HPV-related cancers worldwide. For testicular and other reproductive cancers, the link with HPV is less clear, but the virus's ability to infect reproductive tissues highlights the importance of prevention. Preventing HPV-related cancers involves several strategies. Vaccination against high-risk HPV types is highly effective in reducing infection rates. Practicing safe sex, such as using condoms, can lower the risk of transmission. Avoiding smoking is also important because smoking weakens immune defenses and increases the likelihood of persistent infection. Regular screening, like Pap smears for cervical cancer, helps detect precancerous changes early, allowing for treatment before cancer develops. Maintaining a healthy immune system through good lifestyle choices can also help the body clear infections more effectively. In summary, high-risk HPV types increase cancer risk mainly through the production of E6 and E7 proteins that disable key tumor suppressor pathways. This disruption leads to uncontrolled cell growth, genetic instability, and eventually cancer, especially in the cervix and other reproductive organs. Protecting yourself through vaccination, safe practices, and regular screenings is the best way to reduce this risk. Always consult healthcare professionals for personalized advice and screening options.